Hi everyone, Dr. DeFelice here, and today we're going to be talking about prognosis questions. By the end of this module, we'll be familiar with defining prognosis, applying an EDP framework to prognosis clinical questions, and evaluating the validity, assessing the results, and evaluating patient applicability of studies about prognosis. First, however, let's look at the question of what is a prognosis question. People with a disease and their families often want to know how their condition will affect the progression of their lives. And they may ask questions like, will there be complications? Will anything improve or worsen my condition? Will I survive long enough to see my daughter get married? And these are all types of questions that are usually addressed in cohort studies. Now, remember, cohort studies are observational studies. Most of the time, we can begin with a single defined population, and we follow them forward in a prospective cohort study through time to see if an exposure was associated with a certain outcome, whether the exposure was associated with a disease or not. We also can have those retrospective cohort studies where we look kind of back in time and then we sort through the medical records to see how things progressed through time. So we have our clinical scenario. We have a 4-month-old infant who was previously seen in the neonatal intensive care unit. This infant and their mother is in the office. This is her first outpatient clinic visit. The infant was born extremely premature at 26 weeks gestation. Now we know a normal pregnancy is about 40 weeks, so this is extremely premature. The infant did very well in the NICU. She didn't experience any of the complications that other extremely preterm infants suffer. We know that many preterm infants born before 27 weeks gestation have some major neurodevelopmental problems. The mother wants to know what she should be looking forward to with her extremely premature infant. You are going to do some research on the prognosis and report back. So normally we would set up our PICO question, right? Our population would be infants born prior to 27 weeks gestation or extremely premature infants. But what's our intervention? What's our comparison? We know our outcome would be, are there any neurodevelopmental effects? And this is a prognosis observational question. We might find, because our PICO framework is not completely filled out here, that an EDP framework would be more helpful. EDP stands for exposure, disease or outcome, and population. So the exposure would be birth before 27 weeks gestation. Our disease or outcome would be neurodevelopmental effects, and our population would be infants. So we find an article called Neurodevelopmental Outcome in Extremely Preterm Infants at 2.5 years after active perinatal care in Sweden. And this is from the Journal of the American Medical Association in 2013. We take a look at the abstract and we see, well, we are looking for neurodevelopmental outcomes in extremely preterm children. Perhaps this study could be of assistance to us. So after we found our article, it's time to, as we always do, assess the validity or assess the risk of bias, assess the results, and assess for applicability to our patient. And we start with assessing validity. We have a few questions here that we want to answer. Did the researchers begin with a representative sample? Were the study patients similarly progressed in their illness or health condition at the time of the study? were the study patients followed up for a long enough time as to not miss any important disease outcomes? And were outcome criteria objective? So we'll start with the first question. Did the researchers begin with a representative sample? We have two other questions that can help us answer that first question, and they are, did the researchers define the illness or health condition clearly and objectively? And were there clear inclusion and exclusion criteria? So we can see here that in the methods section, we see who was included in the study, and we can make a determination of whether this is a representative sample or not. So we see that we have 7 Swedish health regions. They collected perinatal and neonatal data on over 1,000 infants born before 27 completed gestational weeks. So that is the definition of the health condition, which is clearly and objectively defined. They also included the definition of live birth, defined as an infant with any signs of life at birth. And they also answered the question, were there clear inclusion and exclusion criteria? They said no exclusions were made. So of note when assessing validity, this study was performed in Sweden, where medical care is easily accessed. And so our study is likely free from something called referral bias. So referral bias is a type of selection bias where study participants may not be representative of the population. We can see in America, perhaps not everybody has access to medical care, but the people who are included in studies would probably be the people who do have access to medical care. So we have a type of selection bias that would go on in that case. Here in Sweden, where medical care is easily accessed, we're probably free of this type of selection bias because everyone has pretty much equal access to their health systems. It would be a representative sample of the population. So next, when it comes to assessing validity, we're going to ask the question, were the study patients similarly progressed in their illness or health condition at the time of the study? And we saw in the methods section that all of the study participants were between birth at less than 27 weeks and 2.5 years of corrected age, which is a way of counting age in premature infants. Next, we're going to ask, were the study patients followed up for a long enough time so as not to miss any important disease outcomes? So the study followed the participants up to 2.5 years corrected age, but we do have to take note that many cognitive difficulties are not apparent in a child before they go to school. So perhaps if we would have followed the children for a longer period of time until they became school age, then we could see what neurodevelopment effects they were having, what cognitive effects that they were having in school. So that's just something to consider when you're considering this study and its application to patient care. So next, when it comes to assessing validity, we're going to ask, were outcome criteria objective and not subject to bias? We can also ask, was there blinding of researchers who measured the outcomes? So in this study, one of the assessments was the Bailey scales of infant and toddler development, that was administered by psychologists. So this is kind of a scale of different neurodevelopmental effects in infant and toddlers, but this particular scale, what they said that it wasn't standardized in Sweden at the time, so that they also had a matched control group so that they could do some comparisons. Also, disability status was measured by physicians. So in answering the questions of whether they were blinded, the outcome assessors were blinded or not, the patient follow-up was actually part of the clinical care. So the outcome assessors were not blinded to the extremely premature birth status of their patients. Just something to consider as we go forward. So think for a second, based on all this validity criteria, would you rate this article a strong study or a weak study? So now after we've assessed for validity and risk of bias, we're going to assess the results. And our questions are, what do the outcomes look like over time? And how precise are the results? We'll start with the first question. What do the outcomes look like over time? So we see that of the 456 children who survived to 2.5 years of age, 42% of them were considered healthy, 31% had a mild disability, and 27% had a moderate to severe disability. It was also noted that boys were at a higher risk of moderate to severe disabilities at 31% than girls were at 23%. And we did see a decrease in the percentage of children with mild or no disabilities as gestational age decreased. So 83% of the children at 26 weeks had, who were born at 26 weeks, had mild disabilities or no disabilities, whereas the children who were born at 22 weeks, 40% of them had mild or no disabilities, which means that 60% had then a moderate to severe disability. We see these little figures here, which gives us outcomes over time of the Bailey scores at 2.5 years of corrected age according to gestational age, and it's compared with the control group. So if we look here, we can see through time. So this is at 2.5 years. We see the cognitive score. The cognitive scores for those who completed only 22 weeks gestation were lower than those for the infants who completed 26 weeks of gestation. Whereas the control group, 37 to 41 weeks gestation, their cognitive score was up here at around 105. We see the same kind of pattern for language score and motor score. And we also see these are the means, the little dots are the means, and the whiskers are the confidence interval. Now, interestingly enough, we have a 99% confidence interval here, which means that 99 times out of 100, if we repeated this study, we would get results within this 99% confidence interval. So how precise are the results? We're going to look at the confidence intervals and we're going to see if they do change over time. And we see that they actually do change. We see the 99% confidence interval is quite wide at the 23 weeks of gestation versus it gets a little more narrow up at 26 weeks gestation. And so a reason for this is because there was a larger sample size for the tighter confidence interval, whereas for the more wide confidence interval, there was a smaller sample size. Next, we're going to assess applicability to our patient. We can ask these questions. Were the study patients similar to your patient? Was their care similar to what can be or has been provided to your patient? Were the study patients followed up for a long enough time as to not miss any important disease outcomes? That's something we discussed a little earlier. And how can you use the results in the management of this patient? So these are questions that I would like you to answer when it comes to applying the results of this study to patient care. Remember, our patient is a 4-month-old infant. She was born extremely prematurely at 26 weeks gestation. She did well, but we do know that infants that are born extremely prematurely may have some neurodevelopmental problems. Here are my references.